So with that said, welcome Dr. Grace Blitzer, UW Health radiation oncologist who works at the Johnson Creek Cancer Center and is interested in bringing radiation information and transferring info from the lab to real life. So thank you very much, and I appreciate you being here, Dr. Blitzer. Thank you.
Absolutely. Happy to be here. Today, we'll be talking about the effects of radiation, both on normal tissues and on cancer cells, but with a focus more on normal tissues and kind of long-term radiation effects. I am a board-certified radiation oncologist right now treating all types of cancers, so we'll be able to give a broad overview of quite a few things. For the outline, first we're going to dive into radiation basics, including when to use radiation, before going into radiation effects, both what the mechanism is, how does radiation affect cancer and your normal cells, as well as the short-term effects of radiation and the long-term effects of radiation on your body. So very briefly, I think everybody here knows this, but in general, we think about kind of three oncologic pillars. There's surgical oncology, so your neurosurgeon who cuts out the cancer in your brain, or your cardiothoracic surgeon who does your esophageal surgery, or your dermatologist who cuts out your skin cancer. There's the medical oncologist who does the chemotherapy or immunotherapy, in general IV treatments that travel throughout the body. And then there's radiation oncology, which is myself. And so that's different types of radiation. There's external beam radiation, there's brachytherapy, which is internal radiation, protons, but in general, it's using radiation to kill off cancers in a localized way. So first and foremost, we should start with an understanding of what exactly is radiation. So the definition is the act or processing, or the action or process of radiating, which is not a very helpful definition, or it's the process of emitting radiant energy in the form of waves or particles. What I like to say is it's basically like high energy X-rays. So down here, we have the electromagnetic spectrum, and that, all of us know that as visible light right here in the center, where we can all see light waves that are visible, so colors, that sort of thing. Then if we go left, we have the radio waves and microwaves, which are also part of our daily life. But as we go right, where we get higher energy, we get into X-rays, which we use for imaging. And then even higher energy than that is what we use to kill off cancer cells. That's the radiation or the high energy X-rays. And so radiation is a beam of radiant energy that, in general, most types of radiation, not all, but most have an entrance and an exit dose. This is an image from Mayo Clinic, but I liked it because it shows a gentleman with prostate cancer, and it shows the linear accelerator with that radiation beam that is entering in and then exiting out. And you can see that's a beam of energy that's treating that pelvis, specifically focused on the prostate. So when do we use radiation? Again, this audience knows this already, but I think it's worth making sure everyone's approaching from the same kind of knowledge base, which is radiation is a local therapy. So it's similar to surgery in that way, that radiation beams are pretty darn good at killing off cancer where we aim them. But unlike chemotherapy, we cannot give radiation throughout the whole body. That would be too toxic. Instead, we use it in focused areas, and we can use it after surgery. So the example, that top right picture is a breast cancer. And the very first step for breast cancer in general is a lumpectomy, where the surgeon cuts out the majority of cancer. But we know that there could be a few teeny tiny microscopic cancer cells left. And those are too small for any surgeon to see for any mammogram, CT scan, MRI. We cannot see those, but we know that they're likely there. And so we use radiation after surgery to increase the chance of local control, meaning decrease the odds that that cancer comes back in the area. We also can use radiation where we can't do surgery at all. So for example, the bottom right picture is showing a larynx. So that's your voice box right here in your throat. And that is somewhere that oftentimes we would try and do radiation instead of surgery, because surgery would be cutting out the entire larynx, which means that you cannot speak normally. Oftentimes you cannot speak at all. And that's pretty darn toxic. And so we use radiation in places that surgery can't easily reach, or where the kind of surgical resection would be very morbid or would have a lot of side effects on a patient that we want to try to avoid. So radiation can be used both for kind of local therapy, cleaning up microscopic cells, as well as bigger, treating the entire cancer and killing off every last cancer cell. But how does the radiation exactly do that? The answer is DNA damage. And so radiation, we talked about, it's that beam of energy. That beam of energy interacts with the DNA and breaks it apart. It uses reactive oxygen species. So if you ever, have talked to your radiation oncologist, they might have said, don't take an antioxidant supplement during radiation. And that's because the mechanism where radiation works is that beam of energy interacts with DNA and oxygen and causes the breaking of those DNA strands. And every cell in your body, including your cancer cells, have DNA. And when the cells try and replicate, they replicate their DNA and then split apart. But if the DNA is damaged, then what happens is this picture here along the bottom, where when the cell tries to divide, instead it breaks apart and is killed, and then your body can reabsorb it. So radiation works through DNA damage to cancer cells, killing them off, and then your body slowly reabsorbs the dead parts of the cancer cells. But what about for normal cells? So again, radiation will still do DNA damage. If you have, a breast cancer cell right next to a normal breast cell, just normal breast tissue, the radiation will damage both of those. But your body naturally has mechanisms to repair that DNA damage, because we're all exposed to radiation just from going outside, right? There's some UV radiation in other ways. So your body can repair that DNA damage, and your cancer cells have, because they want to be growing quickly and mutating, they've lost most of their ability to repair the DNA damage. So cancer cells are more sensitive to radiation versus your normal tissue cells. So here, this diagram to the right shows radiation causing DNA damage. Oh, I apologize. And then it shows there's kind of two choices. Either your body can have those DNA repair mechanisms, and then a healthy cell will emerge and will be able to continue on. Or if the body does not repair, then that cell may die off, and that leads to those side effects that we see for your normal cells. The DNA damage that we talked about, though, is something that builds up over time. So as likely everybody knows, we give radiation treatments in general every day, Monday through Friday, over the course of weeks, because we give a small dose each day, and that DNA damage does build up. And like we talked about, your body cells can repair. So each day you get your radiation treatment, the DNA is damaged, and then your body spends the rest of that day repairing, versus the cancer cells don't repair. And so that DNA damage builds up over time and is much more lethal cumulatively. But your body can't repair absolutely everything, and that's where those side effects come in. Those damage does build up even in the body's normal cells, and the side effects. So side effects, the most kind of deciding, the biggest factor for side effects is location. Radiation, we've talked about this, is a local therapy. So wherever we aim the radiation is where we're going to see those side effects. This is an example diagram from Australia showing radiation to a metastasis in the liver. And you can see here, radiation is aimed all at that liver. And there might be some radiation dose to the stomach or intestines that are around there. So you might get nausea or vomiting or diarrhea, but you would not get hair loss or a dry mouth, because that radiation is aimed at the abdomen and is nowhere near your head or your mouth. We also think about side effects as early side effects, meaning during treatment, and then late side effects, meaning in the months and years following treatment. Early toxicities, again, this really depends on the location. In general, these early toxicities are ones that are happening, or early side effects of radiation. They happen during radiation, and then they build up, how we talked about, where the worst of it could even be a week or two after, because like we said, that DNA damage builds up over time, and your body can repair most, but not all of it. And so that DNA damage does become cumulative. And then as the weeks go on after radiation, they will improve again. So this is a picture of what we would call dermatitis, which just means radiation irritation of the skin. And you can see it starts out looking red, like a bad sunburn, and then it does get to the point where your skin is damaged and it becomes what we call moist desquamation, which is just a fancy way of saying your skin, similar to when a blister, you know how that top layer of dead skin gets rubbed off and it's raw underneath. That's what happens here, is that skin cannot kind of keep up with the radiation damage. And so there gets to be a layer of raw skin underneath because your skin can't kind of keep dividing and growing. And then slowly, as you can see here, it heals. And this is something that's a typical kind of change in time. This is on the worst end, right? This is not something that every patient experiences, but it can be. And it's just showing that your body heals from that radiation and develops scar tissue at the end. But we expect it to be fully healed. Not, a week after radiation, it might still be getting worse, but months after radiation, it will be healed. And they're all different kinds. There's the dermatitis, the skin reaction that we talked about, but there's hair loss, if you have hair in that area. There's nausea or vomiting if we're aiming more towards intestines or stomach. You can have dry mouth if we're treating near where the salivary glands are. There can be a loss of taste, sore throat, diarrhea, again, for more in the pelvis and intestinal area. And then everybody gets fatigue. And fatigue is a side effect that is hard to, it's hard to quantify, right? Some folks will say, oh, I just need an extra, nap during the day. Some people say, oh, I just needed to sleep a little extra. But it's something that most everybody notices. And we think that's from your normal cells repairing and just needing that extra energy to repair. And so making you feel more fatigued. There are also late toxicities. And again, depends on the location of the radiation, but these can happen months and years afterwards. So this is something that our goal is the cancer is cured, and then there are some side effects from that radiation that can be permanent. One of the most common, and what I show here, is fibrosis or scar tissue, as well as telangiectasias, which is just those blood vessels, that kind of almost like a spider vein looking blood vessel. And that's something that we can see after radiation, where your skin has healed and your connective tissue underneath heals, but there can be these kind of scar tissue and abnormal blood vessel formations. There can also be, depending on where the radiation is, sometimes the bone can be weakened, or very rarely, but a serious toxicity is secondary malignancy or a different cancer in that same area of radiation. And that's something that, again, goes back to the DNA damage. Your body's normal cells had some DNA damage that got repaired for the most part, but sometimes that DNA damage can lead to more and more mutations and a second cancer can develop. Again, this is very, very rare, but it is a known toxicity from radiation, and it can happen with the chemotherapy as well, because chemo does DNA damage. I just wanted to include some of the more common breast cancer, prostate cancer, or kind of palliative radiation, meaning for any type of cancer, but with a goal of improving symptoms, and some example side effects of, acutely or those short term. You might see some skin redness, sometimes that where you lose your top layer of skin, sometimes tiredness. And then as well for prostate, you can have GU or genitourinary symptoms, so bladder irritation, where you're peeing more frequently, or you're having that urge to go, gotta go now, or sometimes it can hurt to pee. You can also have diarrhea. And then for the brain radiation, you may have headaches or nausea, vomiting, fatigue, and then late toxicities as well, things like lymphedema, which is swelling of the breast or swelling of the arm, as well as scar tissue, or kind of discoloration of the skin where it might be a little bit tanner or a little bit paler than the rest of you. And cosmetic outcome for breast cancer is something we do worry about. And then for GU, for prostate, We can think about long term, right? Your body has healed, but that bladder that was right there may still have some long-term damage, and that damage is healed with scar tissue. So sometimes you can get a stricture, which is a narrowing of the urethra, or kind of the bladder becomes less flexible because the bladder is like a balloon where it expands with fluid. And if there's some scar tissue, it may be that, instead of having to get up and urinate once during the night, maybe now you have to get up twice because that scar tissue is there. But again, all these are just examples, and it really depends on location and kind of what dose of radiation you're getting, as well as every person is different. Unfortunately, right now, we don't have a good way of predicting. Some people are more sensitive to radiation and some people are a little bit less. And there's no good way of predicting that right now. But in general, we have clinical trials that have looked at hundreds or thousands of patients for these and given us the best possible regimen for kind of the average person. I wanted to kind of do a shorter 15, 20-minute talk about radiation and its effects, and then leave a lot of time for questions if anybody has any.
I think with that in mind, I'm going to stop our recording now so that we can actually have those conversations.